And now, Dr. Megan Borkum joins us to discuss how wellness and lifestyle choices can impact your kidney health.
I'm going to be talking about a passion of mine, which is exercise in the context of kidney disease. I'm going to use the term physical activity and exercise interchangeably, but exercise is just planned physical activity. And I think we need to remember that exercise is applicable at any stage of your kidney journey, all the way from pre-dialysis to whatever modality of dialysis you choose, and to transplant. There are benefits all across the way. So you get a cycle, you get a spiral, but we know that unfortunately we see often our patients have a cycle of inactivity, and that progresses to a downward spiral. So as the kidney disease progresses, due to multiple factors, including the symptoms associated with kidney disease, like low energy, pain, restless legs, a lot of mood symptoms as well, and people do feel quite isolated, especially when they're not part of a community. And associated with that, physical changes like losing muscle mass and losing function, becoming more frail and frequent falls. People become more and more debilitated once quality of life goes down, and there are more hospital admissions, and that's never a good thing. So this is what we really hope to target, and exercise can address many of these domains. So I like the saying, if exercise were a pill, it would be one of the most prescribed treatments. And exercise is so good because it helps many different components of the disease. So firstly, muscle. So we know that with kidney disease, through not using the muscles and through the disease process itself, one's muscle bulk goes down over time. So exercise keeps the muscle active and keeps the muscle strong. We know then there's good science for this, that exercise improves a lot of kidney symptoms. We know that it improves restless legs, it improves fatigue, and it also helps with depressive symptoms associated with chronic disease and dialysis. We know for sure that exercise improves physical function, so how well people can move around in their day-to-day life and do activities of daily living. And we know that exercise improves quality of life. And there's more and more evidence. This is a big area of research across the world about the heart healthy benefits, specifically for kidney patients. Again, both chronic kidney disease patients and patients on dialysis and transplant patients, how it improves heart health overall, both directly and through weight management, as well as helping control blood pressure. So definitely there's a lot of bang for your bucks there. So in terms of the prescription, it's a pretty generic prescription, but it's a good thing to work towards. Obviously, if you're just starting an exercise program, you want to set your SMART goals, as Mike discussed. So you don't want to start by running a marathon if you haven't been exercising for a while. It's recommended to do 150 minutes a week at least of moderate intensity activity. So that's, for example, cycling or jogging or fast walking, or at least 75 minutes a week of more high intensity exercise. So that's things like running or rowing a boat. And then in terms of resistance exercises, that's recommended to happen at least twice a week. So things like this would be lifting light weights or doing specific resistance band exercises, or things like yoga or Pilates. And I like the sing talk test. So when you're wondering about the intensity, you should be exercising at the intensity where you can talk, but that you can't sing a song. And if one works towards slowly building up over time, one can certainly reach this. If you think about 150 minutes spread over the week, it seems like a lot when you look at the number, but if you divide it by 7, it does become more realistic and achievable. So we know that there are multiple barriers, unfortunately, to exercises. And again, this is things that have come from scientific papers, surveys of patients. We know that patients are scared because they don't want to injure themselves. They often don't have support to encourage them and to facilitate exercise. People think that exercise is expensive, so you have to belong to a fancy gym. And often the symptoms are the greatest barrier. So things like fatigue, weakness, and shortness of breath. And people just don't know where to start. From a health professional perspective, bearing in mind that we often don't have access to rehabilitation or exercise professionals, there's often other care priorities. So they're more worried about us as health professionals, we're more worried about the lab parameters and the blood pressure, and maybe less worried about talking about exercise with our patients. And often people don't maybe have the expertise to discuss exercise specific to dialysis patients or kidney patients. But as I'll mention later, there's a growing body of evidence and guidelines that are well available. And I think it's our responsibility to become familiar with these guidelines so we can discuss exercise sensibly and scientifically with our patients. And I think it is something, bearing in mind all the benefits that are possible, that we should start to prioritize in our care plan. So the first step, discussing it, opening the discussion with your health professionals, that's the first step to get going and to overcoming these barriers.